Thank you for joining us. A little bit of housekeeping before we get started. We are going to be recording portion of this session for the end of after she's completed her remarks. We will not be recording those. So if you have questions, you can either raise your hand and just ask them at that point. You can put them into the chat. I can ask them on your behalf if you prefer, but I just wanted to let you know the recording will be stopped for the Q&A portion. So we're delighted today to have Professor Landau here with us to discuss her latest book. I should say I'm Ellen McDonald. I'm a research librarian here at the Fletcher School. Professor Landau has a book that is not quite off the press yet. I think it's going to be released in just a couple of weeks. It's entitled People Count: Contact Tracing Apps and Public Health. If you don't know Dr. Landau, she is a Bridge Professor of Cybersecurity and Policy at the Fletcher School here and in the Department of Computer Sciences at the School of Engineering at Tufts. So she's busy, and we're lucky to have her, even if we have to share her with our engineering friends across campus. She's the co-author of Privacy on the Line and the author of Surveillance or Security and Listening in Cybersecurity in an Insecure Age. So she keeps busy, which would be an understatement. Anyway, with that, I would like to turn it over to Professor Landau. Thank you so much.
So thanks a lot and welcome. And I will do the usual share screen and also say that I'm from New York. And as my students know, I'm well accustomed to being interrupted. So if you have questions, you can post them in the chat and Ellen will monitor and decide whether or not to interrupt. Otherwise, I'll take them at the end. So this is a scene from Wuhan early last spring in February, I believe, when everything that was happening in Wuhan seemed very strange, very far away and quite extreme. But as Dr. Fauci said, everything happened extremely quickly. The first notice of anything going on, the first notice to WHO, the World Health Organization, was December 30th, 2019. It hit China in January. It hit the rest of the world in February, although now we know that there were cases circulating in various parts of the world earlier than February. It hit the world in February, March, April, and early June. And we didn't really understand what was happening. Here are numbers. You can see the spike from New York County in April. We understood that the coronavirus, SARS-CoV-2, spread person to person. We understood that there was respiratory transmission and asymptomatic spreaders and that proximity mattered. But in those early days of January and February, we didn't understand whether or not surfaces needed to be cleaned. You heard about deep cleaning. You still see it in many places. It is possible to transmit the disease from a surface when somebody touches something that someone has sneezed upon, but that is in fact extremely rare. There was a lot we didn't understand back in January and February. There's a lot we're still learning now, including about long COVID and so on. But these particular aspects of COVID, the spreading person to person, spreading through respiratory transmission, which means that when you're standing near someone or singing near someone, especially singing, it turns out, laughing near someone, that proximity really matters. And the asymptomatic spreaders are important. I'll talk about them more later. So what we had early on is the spread in China, and China locked down Wuhan, which startled all of us to lock down a city with that kind of extreme isolation and quarantine. The disease also spread to Korea and Singapore, who responded very quickly to what was happening. So because the disease spreads respiratorily, that is through the air, and because it spreads through close proximity, people started thinking about using phones or signals, radio signals, to determine when two people were close to one another, and one of them later turned out to have the disease, as a way to figure out if someone else had been exposed. And the kinds of signals that people thought about using were GPS, which of course is in our phones and says where we are. It's a Wi-Fi signal that'll say two people are using the same Wi-Fi signal, so they may be in the same classroom, they may be in the same coffee house. And then Bluetooth, which is a short distance signal. It's the signal that connects my mouse to my laptop, my desktop, and connects my phone as a hotspot for my laptop. But I also know that the same Bluetooth signal, which is supposed to be a short distance signal, can go a lot farther. A few years ago, I was sitting at my desk working, and all of a sudden my cursor on my screen started wandering all around the screen. Now, I knew there had been an attack on the Ukrainian power grid that included starting with somebody taking the cursor and moving it all around and shutting down systems. Now, I'd also known that I had annoyed the Russians, but I didn't think I was going to be a target. So the first thing I did is I shouted upstairs to my husband, whose study is on the other side of the house, and so about 25 feet away and one floor up, through a plaster wall. And I said, "Hey, are you moving your mouse?" And he said, "Yes, but nothing's happening." I said, "It is, but on my machine." And that's happened a couple of times since. But the point of that is that while Bluetooth is supposed to be a short distance signal, it is not always a short distance signal. And that'll turn out to be important in using Bluetooth and so on. What Singapore decided to do, and you're going to excuse me, I'm going to keep moving you guys around because doing slides and Zoom is always a little bit complicated. What Singapore decided to do was use the short distance that that phones have on Bluetooth. And they created an app called Singapore Trace Together. And the idea on the app was that if two people have the app, then the app uses, and they have it turned on, the app will send out a Bluetooth signal with an identifier from the phone. So people download the app from the Singapore Ministry of Health. The way they download the app is they go to the Singapore Ministry of Health, or they go to the App Store, they download it, giving their phone number at the time. They give their phone number, they get the app on their phone, and then if they're in the proximity of somebody else who has the app, a digital identifier from their phone is sent to the other phone, and vice versa. So if Alice and Bob are doing this, and Bob is later diagnosed with COVID, when the Ministry of Health finds out that he's been diagnosed with COVID, a contact tracer calls Bob and says to Bob, you've been diagnosed, and we need you to do the following things, including quarantine, isolate, and so on. Here are the symptoms you have to check for, etc. They also say, do you have Trace Together? And if Bob has Trace Together, then all the identifiers that his phone has collected, Alice's identifiers and other identifiers, are sent to the Ministry of Health. The way the identifiers are created is based on the phone number. So when the Ministry of Health gets the identifiers, it observes, because it knows the phone numbers of everybody who's downloaded the app, because it knows the phone numbers of everyone who's downloaded the app, the Ministry of Health is able to figure out from the identifier on Bob's phone that which phone number it applies to. It applies to Alice's. And then they call Alice and they say to Alice, you have been exposed to someone with COVID. They don't tell her who has exposed her. They simply say you've been exposed. And now you must quarantine for 14 days. This is what's called a centralized system, in the sense that the Ministry of Health now has information that Alice and Bob were in the same location. That's an important fact, and we'll get back to it later. Korea took a different approach. Korea decided to look at, and I'm going to move you guys again. Korea decided to use three different sets of things. And this was based on the fact that earlier, Korea had suffered from MERS. Now, MERS, Middle East Respiratory Syndrome, is a disease that spreads person to person. The infection comes from camels. There are not a lot of camels in South Korea. But someone in a South Korean had traveled, a 68-year-old man had traveled in the Mideast. He came back to Korea with a respiratory infection. He went to the hospital. He did not tell them that he had been in the Middle East. They couldn't figure out what was wrong. He went home. When he came back, but he was still ill, he came back. He went to 4 hospitals, 4 different hospitals over a period of something like 10 days. During that time, he exposed a number of people. He exposed, I think, 28 people because he was a super spreader. Those 28 people, 2 of those 28 people exposed an additional 109. So what did South Korea learn from this? One is if you have somebody with a highly infectious disease, you make sure you don't put them in a room like a hospital emergency waiting room with lots of people. They also decided that in the event of another pandemic, and they expected that there would be another pandemic. The reason they expected it is the same reason that any health professional does. We're living increasingly close to wild animals, which provide a reservoir for such diseases. And because of the way people live and travel these days, it's very easy for such diseases to spread widely. So Korea did 2 things. It changed its privacy law, so in the event of a health epidemic, the certain data, cell tower location, closed circuit TV, and credit card information could be shared. And they also changed their health regulations so that they could speed up the approval of tests, in particular tests for a new infectious disease. The diagram I have at the bottom, by the way, is the picture of how MERS spread. And you can see that one person created a cluster in red, another person created that cluster below, and so on. And that was what South Korea was determined to avoid. So when the coronavirus happened, South Korea very quickly put into place the changes that it had done for both privacy and approval of tests. Namely, it collected cell tower information from the people who were diagnosed with having COVID. And they published the routes in a public database. You can see that over here on the top of your screen on the right, saying where those people had been at what times. Originally, they published it saying the gender and ages of the people, and it became very easy to identify who it might be. If there was, for example, a couple of people who did this, who went into an apartment complex, had been food shopping and then went to an apartment complex, and their ages and gender were mentioned, it was not hard to figure out, oh, it was this married couple. After time, the Korea decided not to publish this information. As Korea learned that the spread was not from fomites, from virus on surfaces, once a place was cleaned, it disappeared from the list. So coffee shops originally, if an infected person had stopped in a coffee shop and picked up a cup of coffee, or in my case, a cup of tea, if someone had done that, then often the coffee shop was deserted for days, for at least a day. South Koreans took that information off. The reason for the credit card information on closed circuit TV was that if somebody stopped, for example, at an ATM to pick up cash, but they were wearing a mask and the people around them were wearing a mask, and if you think about the transaction, it's a very fast transaction. There was no need to inform people who had been in the ATM alongside that person that they'd been exposed. But if somebody was in a restaurant and was later discovered to be ill with COVID, then South Korean contact tracers found the credit card receipts of everybody who'd been in the restaurant at the same time and informed them, because of course in a restaurant, nobody's wearing masks. So the closed circuit TV showed who was wearing masks, for example, at the ATM, but also the credit card information and allowed tracing. And so that's what South Korea did. But you'll notice that they didn't use any kind of app for proximity checking. So there are two issues on privacy with this kind of tracking. One of them is that you can track people's locations. And if you track people's locations, you can learn a tremendous amount of private information about them. You can learn, for example, that somebody goes to church on Thursday evenings, but never on Sunday morning. And you think, what's on Thursday evenings at that church? Oh, there's Alcoholics Anonymous, for example. Proximity checking. Human rights workers don't want people to know who they're meeting with. Journalists don't want people to know whom they're meeting with. And sometimes you may not want your friends to know you're hanging out with some other people, or you may not want your spouse doesn't particularly like one of your friends. And so you tend to omit that. We all do this sort of thing. And so proximity checking and location tracking are quite privacy invasive. So when the idea of apps like TraceTogether came up, 3 different groups of cryptographers working with epidemiologists said, can we figure out apps that are more privacy protective, that are decentralized? The data doesn't get shared with the Ministry of Health or the government. Why would you not want to share it with the Ministry of Health? Well, the data from TraceTogether has been shared with the police. So it's being collected for healthcare, but it has been shared in police investigations. These 3 sets of cryptographers and with an epidemiologist thrown in here and there, one was largely based in Europe, one was largely based on the East Coast of the United States, one on the West Coast of the United States, but there was Australia and other parts of the world thrown in too. They all were working independently, all announced a model for doing decentralized data collection, and all announced it just about on the same day, within a day of each other. 2 of them had come up with the same acronym. The East and West Coast ones had come up with PACT, the European one, DP3T. At the same time, they needed to rely on the technology, because if they were going to do proximity checking, Bluetooth uses up a lot of energy. And there needed to be a way to use the Bluetooth signal that didn't drain the battery. If you were using TraceTogether in Singapore, it sufficiently drained the battery that people couldn't run it all the time. If you run the app in foreground, that is, it is the app running on your phone, then your battery runs down quickly. What the Singaporeans had to tell people using TraceTogether is, please make sure to run the app when you're on a bus and so on. But that's, of course, exactly the time when people would rather be running an app to read the newspaper, to play a game, and so on. So Google and Apple stepped into the picture because they could figure out a way that I'm not going to go into now that would not drain the battery so much. And they were using Bluetooth in this, and they wanted a way of not allowing location tracking and no identity sharing. That is to say, when you're using the app is not allowed to collect location information. And it's also, the app will only share with the centralized authority that someone was exposed. Well, I will talk about how the app does that in a moment, but it won't share identities with the centralized authority. They called this the Google Apple exposure notification, because of course it had to work not only an Android phone to an Android phone and an Apple phone to an iPhone to an iPhone, but an iPhone to an Android phone and vice versa. So with a decentralized app, Alice and Bob don't know each other, maybe, and they're sitting and having a 10-minute conversation on a park bench. Bob is later positively diagnosed for COVID, and he enters it into his app on the phone. What happens then is so when they have this 10-minute conversation, their phones exchange identifiers. If Alice and Bob both have the app on their phones exchange identifiers. When Bob gets a positive diagnosis, his identifiers, and his identifiers change every 15, 20 minutes. The reason for that is to not enable anybody to track him around the city. Okay, because his phone is sending out identifiers. I hope I'm making technical sense to all of you as well as regular sense to all of you. But his phone is sending out identifiers. They change every 15 minutes. What his phone does is it sends his identifiers, not Alice's, his identifiers up to the central authority. Alice's phone and any phone that has the app collects the identifiers that have been reported to the Department of Health. Alice's phone then says, oh, do any of these match any identifiers I've collected in the last 10 days, the time that I could be exposed? Uh-oh, one does, I've been exposed. Alice learns she's been exposed, but she doesn't learn who exposed her. And the health authority doesn't learn that Alice and Bob were in close proximity. Make sense to you? If it doesn't make sense, give a shout and Ellen will make me do this again. Ellen's giving me a thumbs up. So it solves one problem, but does it solve the right problem? So let's go back and think about contact tracing. Contact tracing is very old. It started, I believe, with smallpox, maybe even earlier than smallpox, but contact tracing started with smallpox. And the way you do contact tracing in smallpox, as the way you do contact tracing anywhere, is you test somebody to see if they're infected, you trace their contacts, and you isolate everyone so that the disease doesn't spread further. That's in the case of not having a vaccination, not having a vaccine. Now we've had a smallpox vaccine for over a century, for a very long time. And smallpox disappeared from Europe, from North America, and from South America by the 1940s. It was still endemic in Africa and in Asia, but vaccinating everybody wasn't really possible. It was too complicated to do. So instead, what public health did is what's called ring vaccination. Anytime someone was diagnosed with smallpox, everybody that was in their contacts and everybody who was in the contacts, a whole ring around the smallpox person was vaccinated. If you vaccinate somebody early enough, even if they've been exposed to smallpox, they survive. They don't get the illness, they survive. You have to do it early enough. So test, trace, and isolate. Test, trace, and isolate for HIV was different. As with the coronavirus, at first we had this disease that was infecting people in ways we didn't understand. It was infecting gay men. It was infecting heroin addicts. It was infecting people with hemophilia. It was, in the United States, infecting a relatively high ratio of Haitian immigrants, high relative to the population. We didn't understand all of that. Took a while to understand that the disease is transmitted through bodily fluids, semen and blood. And that explains several of those aspects. The Haitian immigrants, it turned out the issue was that the disease had arrived in Haiti before it had arrived in the United States. And so a higher proportion of Haitians were infected than Americans. And that explained that piece of it. So if you're going to do contact tracing here, you have to find out who is sharing needles and who is having sex together. Complicated pieces. If you're going to do contact tracing with typhoid, it's a completely different issue. Typhoid spreads when an infected person handles water or an infected person handles food preparation. So what you need to do there is keep infected people away from those aspects. With Ebola, it's bodily fluids and it extends after somebody has died. And that made stopping the transmission of Ebola makes the stopping of the transmission of Ebola particularly hard, because in parts of Africa where it's endemic, it occurs in wildlife and it spreads to people relatively often. The reason it's complicated in Africa is in some of the groups, in some of the areas in which it's spread, it's very traditional to touch people's bodies after they've died, to kiss them and so on. And you have to stop all of that. And it's very hard to get people to stop their traditions for the dead. So what's important in contact tracing is I wrote this book, I talked to a number of contact tracers. one or two working now, although of course they're extraordinarily busy, and some who worked in HIV and other cases. And what they told me was, more important than anything else is developing trust. When you call someone up and you say, you have AIDS, you're positive for HIV, you have the coronavirus, I need to know who your contacts are. You need to, if you say that right away, forget about it. What you have to do is first say, how can I help you? Here are the services we can provide. Do you need food delivered to you? Do you have someone who can care for you? And so on and so forth. And you develop trust with the person. Then you have to ask for their contacts. Then you have to call the contacts and talk with them and tell them they need to isolate for 10 days of quarantine. Sorry, I get the two words confused. We use them colloquially differently from the way they use them medically. But it all involves trust. Trust is absolutely essential to contact tracing. So let's go to the apps. And I have to say that the Google, Apple exposure notification apps were rolled out incredibly quickly. Think back to what Dr. Fauci said and how quickly the disease spread. Trace Together came out in either February or March. The proposals for the decentralized apps came out in April. And then, of course, you have to implement them. The first one out the door was Swiss COVID in June. Swiss COVID is particularly interesting. Swiss COVID is interesting for the following reason, in addition to being the first one out the door, which is that in Switzerland, if the app says that you've been exposed, and health ministry agrees that you should isolate, that is, the exposure is such that you should thinks you should isolate, then you get paid to stay at home. You get salary recompense, not full salary, but support from the government. The next, another one that was interesting is Irish COVID Tracker. What's interesting there is when you register for Irish COVID Tracker, you have the choice of giving your phone number or not giving your phone number. If you give your phone number, of course, you're not anonymous. But what that means is if you are exposed, you get called by contact tracers in addition to being told that you're exposed. So you're not left on your own getting a piece of information on your phone and wondering, should I, do I need to isolate? What do I do? How do I do this? You actually are held in the hands of public health. The first one to do it in the United States was Virginia in late August. At the time, the app included information about, you might, well, let me leave it there. The whole intent of the apps, Google and Apple and the designers are very clear. The apps are supposed to supplement contact tracing, people contact tracing, manual contact tracing. They're not supposed to replace it. But the apps in the United States were not being adopted particularly quickly. And so Google and Apple came up with something called EN Express. Essentially, it's a checklist for public health departments. Do you want, what distance do you deem is an exposure that causes, what distance do you deem causes an exposure? How long does the exposure have to happen in order for it to be an exposure that you alert somebody, and so on and so forth. But one of the things that EN Express doesn't do is it doesn't say, can the user register their phone number at the time they download the app? In other words, EN Express excludes manual contact tracing from anything to do with the app. So the question is, do the apps solve the right problem? The first question is, does it solve the problem at all? Before Swiss COVID was launched, they ran tests with the Swiss Army, mimicking people sitting on a train using their phones. They did scenes with restaurants and cocktail parties and so on. But if you notice this picture, you'll see that this train car is really a train car within a gymnasium. And radio signals travel differently in an open gymnasium than they do on a tram car, for example. So Irish researchers in Dublin tested the apps on tram cars, and they discovered that indeed the signal drops appropriately as people move further and further away from one another. But then At a certain distance, the signal actually gets a little bit stronger. Think about tram cars. They have glass windows that don't reflect the signal particularly. And then they have metal connections between two tram cars in which the signal bounces back and it appears to be stronger. Am I making sense to you guys about why the signal doesn't show? Shows an odd thing. There's also the whole issue of asymptomatic carriers. What we've learned is that about 30%, 20 to 30% of people are asymptomatic, but in addition to, but they still can infect other people. An asymptomatic carrier carrying the app will never show up unless you do random testing. So somebody who's been exposed to an asymptomatic carrier will never know it and will feel, you know, their phone tells them they're clean, that they haven't been exposed when in fact they may have been. But the other issue about has it solved the right problem involves population. And a study in April, in April, we knew that the city of Chelsea in Boston, near Boston, had 6 times the state average for COVID-19 infections. Why? Well, there are a lot of sociological reasons. Chelsea has a high Latinx population. That Latinx population is largely from Central America. It includes a lot of people who are undocumented. People who know people who are undocumented are often unwilling to get tested, isolate, let public health, let the government know about themselves because they don't want their relatives or friends to be picked up by ICE. A high proportion of this population was working in the food service industry, which is where there is particular spread. And it was also multi-generational, tight housing, which caused another piece of the spread. Black Americans have a different reaction to public health and in fact to the government. Something that of course has came up a lot this summer and has increasingly come up. There's the Tuskegee experiment, in which Black Americans with syphilis, 400 of them were left untreated for 40 years in order to study the disease, which is beyond appalling. I don't even have the right words for it. There's redlining, in which federal housing loans pushed Blacks into certain parts of the city, which were then isolated in certain ways. There's higher rates of pollution, plants that pollute are closer by and so on. Black bodies were used for various kinds of medical experiments, often without people knowing that this was happening. The result is a huge amount of distrust. And so when I talked to members of the Black community who work in healthcare and asked, how will the apps be seen? They said, well, you know, a Black middle-class guy living in a middle-class neighborhood might feel fine about it. But somebody in a poor neighborhood who's used to getting picked up a lot, forget about it. And then finally, I want to talk a little bit about Native Americans. So Native Americans are, the reservations are poor, jobs are scarce, healthcare, health is poor, high rate of diabetes and various other health problems. It's also far to hospitals. Roads are poor and distances are large. So in Arizona, and I'm forgetting now, I apologize, the particular reservation, the White River. Sorry, let me just, I don't remember the reservation. They realized as COVID was coming, they had to change what they were doing. And they changed it in a couple of ways. One is the disease presents in a particularly odd way for everybody, which is that you can walk around with relatively low oxygen levels and not realize it. Because of the way that the disease presents. And so checking somebody's oxygen levels will tell you whether or not they're having problems and need to get to medical care, particularly important for the reservation where people are at a long distance. So the contact tracers started traveling with oximeters, and anybody who appeared at all ill got tested, and if their oxygen numbers looked at all low, they were taken immediately to healthcare instead of waiting and then possibly not making it in time. But the other thing is on the reservation, the Apache, this is the Apache reservation. one Apache reservation. On this the cultural model is that it's multi-generational, but of course there are two sets of grandparents, and not both sets of grandparents live in the same house. And the other set of grandparents may be 20 miles away, but the kids, the grandchildren, often go and spend a couple of weeks at a time, a week or 2 weeks at a time with the other grandparents. So there's the real risk of transmission. So if someone was ill in a house, the immediate question was, where are the other grandparents? And the other grandparents were then visited because the disease could have spread. What's my point with all of these cases? My point is the uptake of the apps is not going to be the same in these different communities. Cultural issues have to be taken into account. And this is really important, but the apps are vanilla. The apps are very plain. They look the same to everybody. New York translated the apps into multiple different languages, but they didn't take the culture along with it, which is much harder, of course. So how does it all sum up? Well, in February and March, Trace Together and the Korean Solution, centralized, were launched. In April, the European Parliament, which has already pressed various privacy laws, said only decentralized solutions are acceptable for governments. In April, Google and Apple announced their collaboration and the apps were launched. The apps do have a preventative function. If a single person who's been exposed gets a notification and isolates, they can stop a whole train of transmission. If you look at the Genentech example, and some of you may be familiar with it, if you look at the Genentech example of spread from that meeting in February, upwards of 250,000 cases around the world happened from one single meeting. So the apps have a positive effect. At the same time, they move resources in certain ways, and they don't necessarily take into account differences, cultural differences and needs. It also doesn't catch everything. What we've learned is that although 6 feet is considered the distance for spread, it depends on how the air moves. And we now know of cases of it spreading 15 feet in a restaurant because of the airflow from the air conditioner. There are also cases of super spreading. This is the picture of the Rose Garden meeting. It most likely did not spread at the Rose Garden, but at the receptions afterwards. That was a super spreading incident, just like the Genentech one. So we need to learn more about how the coronavirus spreads, and the app, because it doesn't collect location information, can't help that way. We also need to learn whether the apps are useful. And it does appear from data that the Swiss and the Brits have collected that they are somewhat useful. But the most important issue is trust. And so with trust, you first need to protect user safety. False positives for poor communities don't protect user safety. It tells people they can't go to work, when in fact, they're actually fine. So if someone gets a positive on the app, they should be able to go get tested. Back in the spring and the summer, that was not easy. The app should always be at user's choice, not coercion. And it should only ever be used for testing coronavirus exposure, not for then discovering 2 people were in proximity, handing that information over to the police. Then you have to evaluate deployment, prior to deployment and during deployment in different communities. With studies done in the UK, in the Isle of Wight, a 97% white community, and in Newham, a community that is very, very mixed, Asian, Caribbean, Black. Isle of Wight, it was the second time it was tested, Newham the first, but the level of acceptance was very, very different. If the level of acceptance of the app is very different, you need to be careful not to deploy resources that help the communities that are already doing well and not help the communities that are doing poorly. And then finally, the apps should be transparent. We should be able to know how they work. So I will take a couple more minutes and do 2 more cases and then wrap. How does it all sum up? Well, in South Korea, which had been hit by MERS, they thought very hard about how they wanted to balance privacy versus public safety. And they came up with a decision that worked for South Korea. It did cause some privacy violations. They changed their publication of data some, but they came up with a solution they were happy with. Harvard had a privacy incident about 5-6 years ago in which information about people's communications, their email, was studied by the deans without prior notice to the users that this would happen. After that, there was a big brouhaha, a study, and very tight privacy protections were put in at Harvard, ones that are quite admirable. Harvard decided to try and use Wi-Fi tracking. Hey, if we know two people are in the same classroom and one of them turns out to have had coronavirus, have coronavirus, then we can inform the other. They instrumented several buildings on campus. They ran tests for a couple of months and decided, because they were already testing people on campus 3 times a week, this did not add enough value, and they got rid of it, the idea, and they didn't run it. But each place, South Korea and Harvard, had a set of principles about how they valued these different things and where they were going to put resources, and they made decisions on that basis. Sometime after the worst of AIDS happened, that is when we began to have treatments and so on, the National Academies did a study on the social impact of AIDS and observed an epidemic is both a medical and social occurrence. The same is true here. The coronavirus has brought into sharp relief the inequities in our health system and the social support system. Now is the time to decide what kind of medical and social interventions we will make and what choices we want. The choices we make will reverberate forever. And with that, I'll stop. Thank you.
Thank you so much. That was really interesting. I'm sure there's some questions out there.